Hello, my name is Daisy, and my topic is multi-state outbreak of Salmonella agnum infection linked to rice and wheat puff cereal. Background information. Salmonella is a bacterial infection caused by foodborne viruses usually transmitted to humans by consuming food that has been contaminated. Salmonella is most common in the United States. The CDC estimates 1.35 million infections per year and 420 deaths per year. Symptoms begin 12 to 96 hours after infection and can last 4 to 7 days. The place of origin was found in pig intestines that were infected with classical swine fever that was discovered by Theobald Smith in 1855. Step 2. Analyze of current situation. On the 5th of April 2008, Multi-Meal Company received a report that the presence of salmonella was discovered during a routine inspection, which caused a recall for the unsweetened puffed rice and puffed wheat cereal. They discovered 28 cases in 15 states. The recall method used the best if used by, with the dates of April 2008 through March 2009. The CDC confirmed a PFGE pattern that are connected to the presence of Salmonella agnum. This was done by interviewing the patients to see what they had consumed the previous days. SWOT analyze. Strength. All infected patients made a food recovery in 4 to 7 days. Some weaknesses. Salmonella is often mistaken for the stomach flu, which causes people to ignore the more severe symptoms, and many would not be aware of the severity of their illness until the recall announcement was made. This provided an opportunity to educate the public on simple ways to take to prevent infection, and as well as available treatment. Threat. Gone without receiving proper treatment, Salmonella can impair the immune system. This is especially dangerous to children or older people. Step 3. Prioritize core issues. Salmonella is often found in meat, eggs, fish, produce, processed or unprocessed food. Food that is contaminated will appear and taste normal, which makes it difficult to prevent infection. Salmonella is adaptable, allowing it to be found in many dry food, in our case, cereal. Salmonella is linked to poor sanitation protocols by companies and by field workers. Often found in intestines or feces by animals, Salmonella bacteria can be spread by contaminated water, environment, and other people. Summer weather is ideal for Salmonella bacteria to grow, which is why the CDC recommends that all food be contained in its proper temperature. Low moisture food means that things like baby formula are not at risk from contaminating or growing any sort of salmonella since it has low water activity. Step 4. Sorry. Analyze alternatives. The U.S. Department of Agriculture and the World Health Organization surveillance international foodborne bacteria and instigates new procedures to reduce salmonella infection. Approach 1. Through the social ecology model. Implicate strength agricultural practices to reduce salmonella contamination. Approach 2. Checking labels and expiration dates to ensure that a product is up to FDA standards, which reduces the possibility of infected products. Approach 3. Regulate inspection of the equipment and factory environment by cleaning and ensuring there is no cross-contamination. Step 5. Recommendation. Recommendation 1. Cross-contamination. When cooking, avoid contaminating fresh vegetables and fruit with any raw meat or chicken juice. This can be done by properly wiping down counters and switching utensils when working between raw meat and poultry. Recommendation 2. Sanitation. Food storages. Checking labels to properly store all food in containers and correct temperatures. Dates. Expiration dates to guarantee that no bacteria can grow and spread. Health inspections. Have all equipment properly washed and sanitized, following all protocols when dealing with salmonella. Step 6. Establishing an action plan. Agricultural lands and safety inspectors should be involved in visiting lands every season for fruits and vegetables before distribution. Farmers should have medical records of all their livestock to keep track of diseases that livestock have been exposed to in the past to know the cause as a way to prevent it from occurring in the future. By 2025, factory equipment should set up barriers to control the flow of traffic between primary salmonella control areas and the rest of the facilities. By 2027, have separate rooms to deal with incoming raw material. Step 7. Finalize report. Individuals shouldn't be concerned about getting salmonella, as most infections can be prevented with proper sanitization. Salmonella cases are usually resolved quickly and are treated with antibiotics. There is a small percentage of cases that actually require hospitalization. Salmonella outbreaks are usually rare and only with 131 million cases by the CDC. Being aware of salmonella and practicing sanitization at home will greatly reduce the risk of infection. Opinion. In my opinion, salmonella is scary, especially since the symptoms are often mistaken with the common stomach flu. However, it can be managed in our daily lives with proper hygiene. Compared to the food industry or companies, that will be more difficult to control, but the protocols that issue rules and regulations to ensure that all food before its distribution is safe, there isn't much to worry about. Still, it's important for facilities to inform the public and its distributors of exposure that food could have. Here are some the reference and citations. Thank you.